Hello, Dr. Carmen Bryant here, Psychological Health Consultants and Services and Redefining Yourself. This is a program that's developed for those that are contemplating leaving, need more information, or are recovering from domestic violence, specifically narcissist abuse. And so today I just wanted to come, hopefully you've been watching some of the videos that lead up to the next video, and just wanted to talk about narcissistic parents. I had someone ask me to talk about narcissistic parents, or coming from a home from narcissistic parents, and whether or not the children are prone to develop narcissistic personality disorder. And just did a little research and wanted to talk about that a little bit. And so, first of all, allow me to talk about some of the signs and symptoms of a narcissistic parent. First of all, do understand that when parents that have a narcissistic personality or NPD, narcissism, these parents look at their children as an extension of themselves, their objects. And these children are, I'm reading at the same time, so I apologize. But these children are, the parents live through the kids, so they use the children to live through them. So they vicariously lived, hopefully that was the right word, they live through their children, and so they try to fulfill their own needs through the children. Those things that they didn't succeed, or those things that they didn't fulfill, they try to do it through the child. So they set their own goals and they force their own thoughts and their opinions on that child. That's supposed to be nurtured and valued. And so what happens is a lot of times there are expectations for the child that's unrealistic, and if the child doesn't meet the parents' expectations, they're punished by withdrawing love or withdrawing affection. For example, a mother that may be overweight, that desires to be thin, but the daughter is thin, and so they'll use a lot of manipulative tactics to try to keep the daughter thin. Things such as you're getting fat, you don't need to get fat, because it's all a reflection of her. So if the child is overweight, then the parent may be a failure because the parent is overweight. And so there's a lot of manipulation that goes along with that to try to keep the daughter at a low weight, and the daughter may develop an eating disorder, bulimic, anorexia, all because she's trying to satisfy a narcissistic parent to avoid having affection, love, or nurturance from being withdrawn from her. So the more the parent withdraws the attention or the nurturing or the love from the daughter, the more the daughter will do to try to please or appease that parent. You don't look good, you look like you've gained some weight, you don't eat that much food, or you can't fit into this clothes, or even ignoring her. So let's see, what about marginalization? A narcissistic parent will always compete with their children. They're competitive with their children, and so as the child begins to grow older and become more independent, non-dependent on the parent, it challenges the narcissistic parent's self-esteem. Remember, a narcissist has a very low self-esteem, and so as the child is growing, and we always, as parents, we always want our children, normal thinking in normal households, you would always want the child to do better than you, grow and do better than you. You teach them things where you made mistakes so that they won't make the same mistakes, and we always want to push the child forward to do better than what you have. Well, in a narcissistic home, for a child to do better than the parent is a direct challenge on their self-esteem. And so they'll do anything that they possibly can to put the child down. They won't, so that the parent will remain superior. They'll say things like, you're not as smart, or nitpicking, unreasonable judgment, just criticism, invalidation. They always set standards that are too high for the child to reach, especially dealing with their emotions. They do manipulate the emotions and rejection, or even something that the child, they're never good enough, or they never do well enough, or A minus is not good as A plus. You can do better. You put your mind to it, and you can be the best. You always have to win. Even in sports, you have to win. You're not good if you don't win, or if you're not first. You never want to be second. So now the child is learning to judge their value based upon where the parent is providing that standard. If that makes sense. Let's see. They'll work very hard at lowering the child's confidence. And let's see. Let's talk about grandiose superiority. So remember that that narcissists and narcissistic parents have an inflated self-image as it is, and they're kind of conceited, and so they often don't treat their children like humans. Remember, you're dealing with a person that lacks apathy, and so they can't relate to their own kids. That they're hurting the child, or put their feet in the child's shoes, that they desire to be loved and cared for. They cannot empathize because you're not following what the guidelines are that I've given you, and that's to satisfy my needs or to make me look good in front of people. Their accomplishment really makes the narcissist look good. So if the child graduates with straight A's, is the best basketball player, this is all a reflection on the parent, makes the parent look good. They objectify the child. Let's see. Always making sure the child knows that the parent was better than they were. Let's see. Let's keep going. A superficial image. We'll go to the superficial image. And so a narcissistic parent will always make sure that the child knows how special they are, and they excuse their behavior by letting the child know that I'm the parent. You are to respect me. You are to value me. So a lot of times the narcissistic parent does not take does not take accountability for their own actions. Even when they do things to offend the child or hurt the child's feeling, they excuse it because they are the parent, or I'm of a certain age, but you are to respect and honor me. And so they don't take in consideration that they can be offensive or hurtful, and they just excuse that behavior by the fact that they are in a parental role or a authoritative role, and so they normally say whatever they want to say. They sometimes excuse themselves by saying, I just say what's on my mind, I'm just being honest, you don't want to hear the truth, but really what they're saying is very offensive, very hurtful. Remember, another thing that narcissists do is a smear campaign, or they gossip. But they'll talk to other family members about the one that is successful or the one that does not comply to the group norms of the family. This is what the family does. You're not a part of the family because you went in this direction, or you don't respect me. Basically, they are not controlled by the parent, so the parent is unable to control that individual person, and so of course they have their followers and their own, the other siblings, if there's other siblings or other family members, that they will make you look as if you are a very defective, disrespectful, or horrible child with issues, and this is no way to treat a parent. And all it is a sense of power and control, to control the child. But the child, because they want to be loved by the parent, oftentimes will comply with their demands to maintain control. That means in every aspect of their life, coming in their home and telling them what to do, how to raise their children, or even interacting with a spouse of a child, just the spouse of their child. But imposing their thoughts and how they do things, or this is how we do things, and whatever you decide to do, or whatever you have learned to do, which could be better or worse than the parent, it's always stupid, and that's not how you do it, and it's wrong. They are manipulators. They do manipulate, and some of the manipulation is not covert manipulation, and for a lot of female narcissists, very dramatic. The dramatic So a lot of that includes guilt tripping, making you feel bad because you won't follow their guidance, or you won't comply to their demands, and they tell you you're ungrateful, you're disrespectful. I can't believe that you would treat me that way, and I'm older, or I'm handicapped, or I'm sick. A lot of times they also use illnesses to divert your attention to them, even in the say, for example, if they have offended you or hurt you deeply, or something that they did or said was very inappropriate, and you had to address that. What they'll do is divert that attention to, I'm sick, I need to go to the hospital, I'm not well, so they do a lot of blaming. It's your fault that I'm not happy. You've caused me to be this way all these years that I've raised you, such an ungrateful child, and this is how you do me, and I would be happy if you would do this, but you won't even do this. So it's a power and control thing. Shaming, for example, your performance or the things that you do is an embarrassment to this family. Your thoughts about religion, or your lifestyle, or what you do, or your choice of career, that is an embarrassment to this family, and it doesn't conform with what that narcissistic parent wanted for the family, or if they wanted everyone to be doctors, and that's not something that you wanted to do because you didn't do it and you became a electrician or a plumber. You are an embarrassment to the family in order to force you to try to comply with the standards, and so they'll shame you in front of your family, shame you in public. Negative comparison. Why can't you be as good as, or why can't you do, or her son or her daughter does this, and you're not normal, or you're abnormal, or this is not normal. Unreasonable pressure. You perform. You will perform better. This is an example. You will perform better in order to make me proud. So your performance is based on how they feel. The things that you do is based on how they feel, not your success or not your accomplishments. Manipulative reward and punishment. If you don't pursue a college major I chose for you, I'll cut off my support. So I'm not going to pay for your college education unless you go get this type of education. If you don't get this degree or pursue this right here, then I'm cutting off all financial support. That's one example. Emotional coercion. You're not a good daughter or son unless you measure up to my expectation. This could be very overt, they'll say it, or it could be a kind of covert, implied. Inflexibility and touchy. So a lot of them are very emotional. Let's see. Very easily triggered. They'll do things dramatically, dramatics, in front of the family, feign sickness, feign fainting, leave the room dramatically, enter the room dramatically, so all the focus is on them. They lack empathy. I said that earlier. They lack empathy. A father, for example, that has daughters, and may feel that they have to look a specific way, do specific things, and if you don't, but they don't, they're unable to connect with the child's thoughts and feelings. They don't validate their thoughts and feelings as being real or even relevant. Let's see. They usually, and kids will also respond in their own survival techniques. They either fight back and stand up for themselves, or if it's too much pressure, they'll distance themselves, or they'll freeze and substitute their invalidated real self as a false, so they'll play a role. And they adopt the traits of the narcissist. So sometimes, part of the answer to the question that was asked is, do all children, do children of narcissistic parents develop narcissistic personality? The answer is not all of them. Some of them actually have to adopt a role or play a certain role, and sometimes adopt the traits of the narcissist in order to survive in their environment. A lot of them do break free, and when they break free, sometimes, they have to cut off the parent. And when they cut off the parent, a lot of times they do deal with guilt of feeling like, I love my parents. but they're very toxic. It's very hard for me to be around them. I distance myself from them. I try to be respectful, but every time I come around, I'm being abused. So they try to be respectful, but they're being abused. No one is no one should be abused, period, by friends, family, parents, spouse, boyfriend, girlfriend, doesn't matter. Even in that, with a parental relationship, there needs to be some type of boundaries, and respect goes both ways. A child needs to be respected as well. True enough, they may not understand what we understand at our level, but they're still, their thoughts and their feelings are still very valid, and it needs to be recognized. A lot of narcissistic, like dependency, codependency, a lot of narcissistic parents have the expectation that the child should take care of them in any kind of way, emotional, physical, and financial. There's nothing wrong with taking care of elderly parents that are aging and need help. There's nothing wrong with that. But when it gets to a point where they're asking for unreasonable sacrifices, and they're very capable of taking care of themselves, that's that codependent, dependent type relationship. Jealousy and possessiveness. Remember, the child becomes a possession or an object, an extension of themselves, and they're usually very jealous over the children, especially and a lot of times they don't show it, but they're very jealous over the children, especially if the child is able to succeed further than where the parent was, even in education, in success in their career path, academics, in that area. They're very, very competitive and critical, and they'll use rejection and to punish, even though it doesn't sound realistic, or it doesn't sound normal. That's what abnormal personality is, abnormal. So let's see. No one is ever good enough for their child. Every romantic partner, and they may be good for their child to get them out of the house, whatever, but no one is ever good enough, and so they kind of isolate their children as well. They do tend to use neglect as a punishment, and because of the fact that they have a problem with empathy, sometimes neglect is very natural for them. I don't understand why you want me to put this much emotion into the relationship. Let's see. Even neglect with, if the activities that the child is doing, whether it's choir, basketball, sports, something, a lot of times, unless it actually benefits the parent is not going to come out and support it. If it makes the parent look good, then the parent will come out and support it. So that's that on that. And let's see. Another one that I was kind of looking up and looking at, when you have children that grow up in a household like this, a lot of times they bear anxiety at a very young age, and so they grow up a lot of times to be very anxious people, general anxiety or even social anxiety, but they because the household is very, very intense, because remember, it is power and control. They're not in an environment where they're being nurtured and loved. They're being in an environment where they serve a purpose. They are a supply. Remember, you go back and look at the videos that'll tell you supply. And so in order to win affection, is like buying affection. To win affection from the parent, their thoughts are usually is trying to prove themselves to the parent. I keep failing my mom or dad. I'm stupid. Something's wrong with me. But most of the things that they do, they try to prove their worth to the parents. And as they become older, a lot of times I have people that come into counseling that they're still trying to prove themselves to their parents, that I'm worthy, I'm smart, I'm not dumb, I'm doing something with my life, but it's never enough for a parent. The standard is entirely too high. So let's talk about the personality disorder itself, and develop from childhood, how it, not specifically how it developed, but in like children. So we know that when children are young, children are just selfish by nature. That's just how they are. Me, me, my, me, look. And so usually as they're growing up, their parent normally teaches them how to be empathetic and to be respectful for other people and to think of other people's feelings and work on their self-esteem, that you're a beautiful young lady, you're a handsome young man, you're very smart. Just because you failed in this doesn't mean, we just work a little harder. And so normal affirmations and encouragement to build that self-esteem, to let them know that they don't have to be perfect, as opposed to a narcissistic parent, the expectation is that you always have to be perfect, and no matter what that child does, they'll never be perfect. And so, as they grew up into teenhood, you normally find, selfish, self-centered, and they're struggling for independence. They need mom and dad, but they don't need mom and dad. Stop telling me what to do. You don't know what you're talking about, but I need your advice. Eventually, as they grow older, they start to develop more autonomy, and their self-esteem, and become more resilient because life happens, but you have to remember they're kind of self-centered when they're growing up, especially as teenagers. A lot of times they're kind of self-centered. You're having to teach them as they grow. Remember that a narcissistic personality disorder, it's rooted in a lack of empathy, this grandiose way of thinking to themselves, this entitlement, and so they're usually like preoccupied and arrogant, preoccupied with these fantasies of self-importance, this success and powerful. They're successful and powerful, and they exaggerate accomplishment and their popularity. Once they explain themselves to you, you would think that everybody knows them and loves them so much, and a lot of people that they're around don't like them at all. They don't like their personality at all, and they try to avoid them. So of course, in their eyes, there's something wrong with you, not them, because their egos are so ginormous. I think that's a word, ginormous. I'll look it up. A lot of things that they do, they deal with fear and anger, and they manipulate. They always manipulate. It's hard for them to have normal relationship with people. That's the whole dysfunction of the personality disorder, is that they have a problem connecting with people. And there are some things that you can look for in your own children, some signs, that there could be a risk of your teens developing narcissism. But as I said, I'm on a screen, so I can't see your kids. I don't know. I can't diagnose your children. That would be something that you would have to take them to another professional for, to kind of look over, to assess. But some of the signs are persistent bullying, making fun of, threatening, degrading, or scapegoating, which includes the parents and adults. Persistent need to win no matter who hurts, so that all costs they have to win. They have to win no matter whose feelings they hurt or who they hurt while they're trying to do it. Persistent lying, so compulsive lying to benefit themselves. A lot of times the lies are someone else's fault, but they don't take accountability for themselves. Egotistical view of extraordinary self, so they're extraordinary and they're so entitled. They're preoccupied with getting their own needs met over other people's, so they're not empathetic. They don't care about other people's needs, it's all about themselves. That entitled attitude, they're aggressive and respond very harshly to criticism, and when they're wrong, they'll feel upset, so they take it overboard. They go overboard with it. They repetitively blame other people for bad outcomes, so they don't take responsibility for themselves, and it's everyone else's fault. Everyone else has a problem. They're very, very competitive rather than cooperative. So let's move over to the next one. Some of the signs of a personality disorder. This is for parents and children. Some of the signs is, first thing is you have to remember. Let's talk about causes. We're talking about causes. So the cause of a personality disorder, specifically we're talking about narcissism, but the cause of a personality disorder has not been definitive, meaning that you can point to one thing that leads to this personality disorder. It's hard to determine like exactly what it is that caused an abnormal personality development, because a personality is developed from time of birth. As you grow older, it either gets worse or it gets better. And it's a mixture of like genetic factors, so genetics plays a big role in it, family history of disorders and upbringing, the caretakers, how they were raised, a dysfunctional home early in early childhood, and an adolescent may have a big impact on developing a personality. And when you talk about there's also a lack of constructive criticism. So parents that have a problem with correcting their children or disciplining their children, and when I say discipline, I don't mean abuse them, but what I mean is, parents that have a difficult time in giving them constructive criticism, or even holding them accountable for their actions, or make excuses for them all the time. And also on the other end of the spectrum, excessive praise, and sometimes parents deal with guilt parenting. They feel guilty about whether the father or the mother is no longer in the home, and so they kind of overdo it. They're excessive, they're extreme when it comes to the child. That's my little prince, that's my little princess, she can't do no wrong, he can't do no wrong, and excessive praise, and so now you're building this sense of entitlement in the child. So those are things that are also to be looked into. One of the things that I've noticed in a clinical setting, dealing with a lot of the males that present with narcissistic personality disorder, they have a history of sexual trauma, sexual abuse in their history. That also affects the personality development as they're growing up, and it's usually like childhood sexual trauma for them. Some of the, let's see, there was something else I wanted to say. Can I find it? Okay, let me move on to the next one. So now let's talk about the personality disorder in general. It is a unique pattern or enduring pattern of how people think, how they feel, and how they behave. So this is your personality. I'm usually happy-go-lucky. I'm gonna joke with you. I speak to everybody, type of person. That's just my personality. I have been a little bully sometimes. I think maybe the military has played a role in that, being a bully and telling you what to do. But I think I'm kind of bossy because I'm also the oldest of 4 siblings. I'm the oldest, and so I was kind of the bossy person in charge all the time. So that's a part of my personality. I'm a take charge type of person. I'm a protector, because I was a protector as a child, because I protected my siblings. I'm just a natural protector. If you're with me, I'm going to protect you. I'm also an encourager. I like to encourage people. I hate to see people hurting, but I try not to be over empathetic. And so I think that plays a role in the fact that I'm a clinician, a counselor, and I work with emotions a lot. But that's a part of my personality. That's, but that is what a personality is. That is the way that you think, your unique way of thinking, acting, behaving, and feeling. And so the next thing that I wanted to go to is the question of what causes personality disorders. So some of those, and this is still in regards to children from narcissistic parents, and how this personality disorder may be developed. It's not hard, definitive. This is exactly what it is, but there are a lot of contributors to it. Biological factors, meaning your genetic makeup and temperament. Also your environmental, we said a few minutes ago, environmental factors, your life experiences. Remember I was saying that a lot of them have been sexually assaulted as children, molested as children, especially in your early lifehood experiences. So let's see. So we said the genetics, and so next I wanted to address where'd it go? We did talk about the biological factors, how a child is raised, what they have experienced. Okay, so I got that part. So let's go to the next part. So another one of the things that I wanted to address is the theories of, I'm not going to address all the theories of personality development because there's a large variety of personality development. This is the book that we used on the master's level, which is Theories of Personality. And there are many theorists. The most famous of them all is Sigmund Freud, and some of them think he's kind of creepy, but a lot of the things that he did outline for that era, even now, makes a lot of sense. Have an open mind, it does make a lot of sense. But there are a lot of theorists that theorize about how personality is developed. And so just briefly, let me go through some of the stages of development. This stages of development for people that, so you can implement, what you've just learned about personality development. You can implement that in how the people develop, the stages of development. And so Sigmund Freud stages of development, he discusses the oral stage, which is the very first stage that begins at birth. And it's the oral fixation, that soothes babies, the bottle, the nipple, the pacifier. And so they seek that gratification to gain pleasure. That's what he says, but it's the oral fixation. And each stage has to be mastered successfully. So imagine being traumatized at an oral stage. If there wasn't food there, that's the stage at which children are learning to vocalize what they need. I'm hungry, I'm wet, so this is the oral stage. But if those needs are not met right there, that affects, just think about it as a notch. That's a notch in the personality. There's the anal stage, and this is where the theory focuses on controlling. They're learning how to control their bowel movements and maintain bladder control. And this is where they're supposed to be learning how to gain that ability and feel independent and feel like a sense of accomplishment. Imagine, usually it's accomplished, the stage lasts up to about 3 years old. So imagine those children that have been traumatized in this stage. For those children that have been traumatized or sexually exploited or sexually molested, a lot of times they don't have control of the bowels depending on how they were traumatized. And so sometimes the learning to control the bowels and maintain the bladder takes a little longer because of damage or because this stage has been affected. Then you have the phallic stage. This is the stage in which males and females realize that they're different. Let's see. The next one is the latent period, which is a period in personality development where children focus on relationship with their peers, finding hobbies that they enjoy, and pursuing their interests. And this is usually between 6 to 12 years of age. And then the genital stage, which it starts about 12 years old. This is a stage where kids go through puberty and they start gaining sexual interest. They interest in people around them and they're learning to be well balanced. So imagine if any of those stages of development have been affected. So let me go to Erik Erikson's stages of development. So his stages of development deal with infancy, which is the focus of trust and mistrust. They're learning to trust or mistrust the caretakers. So as I said before, in that infancy stage, imagine if they're not getting their needs met at that time. So they start growing up under the assumption that it doesn't matter what I do or say, my needs will never be, my needs are never be attended to. I'm wet, I'm hungry, and they're having difficulties in having these needs met. Okay, look at it as a notch in the personality. So 18 months to 3 years is autonomy versus shame stage. This is where they're learning to walk, talk, eat, gain motor skills, small motor skills, as well as toilet training. And this is a vulnerable stage. And if parents are harsh, especially during potty training, it can create a child with a low self-esteem and anxiety. 3 to 5 years, this is initiative versus guilt stage, and they copy the adults. So they're mimicking the adults around them. And so they have these little YouTube posts of these children mocking their parents, but you can see that in the household they're abusive. And they're mocking it, the things that they say. So they're mocking their environment. They're mocking the parents around them. They're learning to do things on their own, such as get dressed. And if children feel guilty about doing these things, they'll have difficulties later. 6 to 12 years, this is the industry versus inferiority stage. And this is where they're gaining a method. Virtues are method and competence. This is the stage where they compare their worth to those around them, and they may feel inferior if they do not measure up. So see, inferiority versus superiority. So 12 to 18 is identity versus role confusion. This is virtues about devotion and fidelity. This is the stage where peer relationships are important. Teenagers are questioning themselves. They're trying to find themselves and where they fit in. They're trying to figure out who they are, what their next plans are. And so often the role confusion is their parents are pushing a different version of themselves than they may feel. A parent pushing themselves on the child, so they're confused, 18 to 35 is development outcome and stages: intimacy versus solidarity. There we go. Versus isolation. And these are basic strengths of love and affiliation. This is about finding satisfying relationships and starting a family. Now imagine if all those other stages have been affected. What type of relationships they're going to get in. So this may not be a successful quest. 35 to 55, they feel midlife crisis. Generativity versus self-absorption or stagnation stage. 55 and so until death is basic strength. In this stage of wisdom and ego, outcome is integrity versus despair. Now think about it. If you're growing up in a household where all these stages of development have been affected, you are prone to begin to display personality development. And I said that to go back to what I originally said in reference to narcissistic parents and children from narcissistic homes. Does that necessarily mean that the child will have narcissistic personality disorder? Absolutely not. Some do get away and become autonomous to recognize where they're coming from. Are there some effects? Definitely, because a lot of the children or adult kids of narcissistic parents have developed some features or have adopted some thought patterns or behaviors from the narcissistic parent. So hopefully that answered the question. If that was too much, please let me know. But I tried to, and the whole thing is that, like I said, narcissistic personality disorder is a personality disorder, number one, that's developed, from childhood up. But there's no definitive answer like this is exactly what caused it. Parents that are over nurturing and parents that are under nurturing. Abusive parents, that develops the personality. So whether a child develops narcissistic personality or not, depends on their environment. Remember, genetics. And like I said before, a lot of the male clients that I've had in the past that displayed narcissistic personality disorder symptoms, a lot of them have had sexual abuse as a traumatic history. So hopefully that answered the question. If not, please email me and you can give me some more detailed questions if you want me to talk about anything else. Thank you so much for listening. Thank you for taking up your time. I know this is really, really like clinical. It sounds like we were in school. But I just want to lay a foundation as we talk about narcissist abuse to give you some ideas of what it looks like. Please subscribe to my YouTube channel at Dr. Carmen Bryant, and you'll see I have a white shirt and a bun. Dr. Carmen Bryant, overcoming narcissist abuse, or I think recovering from narcissist abuse, but it's Dr. Carmen Bryant. You're welcome to go to my Facebook page, Psychological Health Consultants and Services. You can email me at drcarmenbryant@outlook.com. That's DRCARMEN. Bryant, BRYANT, at outlook.com. And you are welcome to email me questions if you don't want to post on the YouTube channel where I can respond to it in public. I do screen them before I post them. Or if you prefer to stay private, you're welcome to email me and ask me whatever question you'd like to ask me or some ideas on topics you'd like me to talk about. So you guys have a wonderful day. Thank you for tuning in. And please, as I said, subscribe to my YouTube channel. You have a wonderful day.